in every 1,000 births, about 82 women died during child delivery. And also, in every in neonatal deaths, about 55 children died during child delivery. So it's a bad thing as it is for a country, and it's not a good record that we rank the second after India in maternal neonatal mortality rates all over the world.
The population of women in their childbearing age in the country suffer health issues surrounding birth. While the country represents 2.4% of the world's population, it currently contributes 10% of global deaths for pregnant mothers.
Nigeria is one of the leading countries that have the highest number of maternal mortality rates.
The World Health Organization estimates the maternal mortality ratio to be over 800 maternal deaths per 100,000 live births. What factors are then responsible?
In Nigeria, we have this issue of poor access to quality health services, and especially, in the rural areas. Our women in the rural areas have this issue of accessing good, health care, especially, the pregnant women. We have both bad road infrastructure in Nigeria. So there are even those who are not living too far from the capital of their local government or their state. But you discover that when an emergency occurs, before a woman is taken to the city, we already have a complication. And then truly government need to do more on this. You need to encourage the midwives. Even the few who are in the local government need to be encouraged so that others too will see them doing well and they will be encouraged to take up employment in the rural area.
Professionally, there are causes medically that can attribute to these maternal mortality rates, like eclampsia, what we call eclampsia, pre-eclampsia, anemia in pregnancy, postpartum hemorrhage, placenta previa, and the rest of others. But however, there are also some people, women, who seek for non-professional care outside a licensed and certified health professionals like the midwife, the doctor, and the doctors and other nurses. This can also attribute to these mortality rates. You see people who are in white uniform, even a chemist, those who sell drugs, they call themselves nurse. Those who you see have a situation where doctors at own hospital gather some group of people, train them and call them nurses. They are not nurses. We don't have anything called auxiliary nurses in our curriculum. If you're not a nurse, you're not a nurse. If you're not a nurse, you're a quack.
Also, regulating the health space is important to prevent quackery.
The regulatory body in charge of who licenses nurses to practice in Nigeria are Nursing and Midwifery Council of Nigeria. Our own, the association, the National Association of Nigerian Nurses and Midwives, we also, in partner with Nursing Council of Nigeria, we regulate the profession. Like in each state, we have what they call Nursing and Midwifery Committee. That Nursing and Midwifery Committee, the state chairman of NAM and secretary is automatic member. The director of nursing services of a state is the chairman of that committee. They are the ones saddled with the responsibility to check this quackery in the state.
The National Reproductive Health Policy approved in 2010 by the federal government aims at ensuring availability and access to full sexual and reproductive health information and quality services. Yet, the death rate is on the rise, with children dying from malnutrition.
Every child born should be immunized against this childhood disease. That's what we call immunization. It is expected that every mother should give a child what we call exclusive breastfeeding, at least for the space of 6 months to 1 year, if possible. So that will help to increase the child immunity and also to prevent the early childhood diseases.
Enlightenment is required in rural areas as religious beliefs, vaccine apathy, and accessibility remains major contributory factors to maternal births and child development. The government and traditional leaders need to do more on reproductive health in Nigeria. Olije Wapera, Arise News.